Hey everyone, Brian from the PT channel here, talking about being a center manager, outpatient orthopedics, PT salary, and outpatient orthopedics. Really just general topic about outpatient orthopedics. Now, for those who don't know, outpatient orthopedics is a part of physical therapy that people come from their house or wherever they're at to visit you to be seen for 45 minutes to an hour and then go home. It's not like it's an inpatient or assisted living facility or hospital or anything there too. Now, they do have outpatient clinics in a hospital where people can go be treated there because locally it's easier to get to. But outpatient means that they come, you're seen for 45 minutes to an hour, 2 to 3 times a week for several weeks. Now, outpatient is a great setting for a lot of therapists. Now, myself, I always like to go in the outpatient, and I feel like if you're going to be outpatient orthopedics, you're going to be outpatient orthopedics. If you're not, you're not. It's two different worlds of, outpatient and then everything else. There's skilled nurse facilities, acute care, inpatient, hospitals, home health, just really a good multitude of areas for therapy, which is great. But outpatient takes the cake for what you have to know. You have to be the most educated, well-versed person, stay up on your CEUs to do all the different type of therapy on there. And that being said, you think you would get paid pretty good to the most. Now, therapy in general, you get paid pretty well. I'm not trying to put that down. But outpatient orthopedics is kind of the set where you get paid the least and you know the most and you do the most. You have to treat everything in the body. You have to be able to treat a lot of different diagnoses from different neurological conditions like stroke, Parkinson's, to outpatient orthopedic or orthopedic conditions like back surgery, neck surgery, shoulder surgery, rotator cuff, ankle surgery, fingers, toes, knee, ACLs, total knee replacements, everything, where you're going to see them for months. So you got to get them and how to progress them. Now, the average pay is going to vary from state to state, area to area, or part of the state versus the other. Now, you can generally think to get paid high 50s to high 70s to starting where you're going to be at as a new grad. Now, you work your way up, hopefully get 2 to 3% raise every year, and work your way up to getting a nice salary. Benefits are paid full time. It's usually 30 to 32 hours or 40 hours a week, anywhere between that. PTO, holidays, good pay like that. Chance for bonuses, chance for annual bonus, quarterly bonus, work your way up from a staff therapist to a center manager. And that's what I did. I was a staff therapist, then worked my way up to be a center manager of a clinic. And it's great, right? I always thought I wanted to open up my own clinic, but it's tough to get on insurance plans and worry about all that. You open up a clinic, you're paying hundreds of thousands of dollars, even close to $1 million before you even see one patient. It's just not worth it to get paid all that too. Then you try to get on insurance plans and they don't do it. After talking with a bunch of people that have tried, it's really not worth it unless you have a good referral source, fee for service, or you have enough clientele that you can do that. But starting out, the average person does not. So I became the center manager of a clinic and worked my way up. And it was great. You become staff therapist to center manager to market manager to vice president or something, whatever you want to work your way up to. I was happy with being a center manager. Now, center manager, that comes with a pay increase. You're probably going to get paid $4,000 to maybe $6,000 more. That's great, right? An extra $500 a month if you're lucky, which is good. It's nice to get paid more on there too. But ultimately, you got way more responsibility because of it. So if you like the clinic, you like your boss, you like your staff, you like the environment around you, and you like your patient population, and maybe it's a win-win. Now, center manager has to do a lot. He has to treat patients, has to worry about the numbers, ordering, billing, the productivity, and the financials, plus be a therapist. So I was the head therapist and the center manager of a clinic, and it was great. Sometimes the staff was a little tough on there too. You had a front desk person, an occupational therapist, and other staff therapists there too. So you had a couple of different disciplines, and it was a great situation, and we were doing well. We hit our numbers every quarter, because you're basically judged week to week, month to month, quarter to quarter, year to year. And your EBITDA, which is earnings before interest, taxes, appreciation, is basically the number that you're supposed to make for the month, for the quarter, and for the year. And that's it. That's the bottom line. When you work for a good corporation, you're only as good as your numbers say you are. And that has no bearing if you're a good therapist or not. You're supposed to make $10,000, you better make $10,000 or go over. If you make less, they want to know why. No excuses on there. And that's the business side of PT. Being a center manager, that's annoying. Most people go into physical therapy to help people, to treat patients, to treat a lot of patients to get them better. Business side, not so much. Business side of things taints you as a therapist. You worry about your productivity, your numbers, your insurance reimbursement. Is a staff therapist going to be called out? How am I going to see these patients? How many patients do I need to see a day, a week, a month? How much money do I need to make? Am I billing and coding correctly? Is Medicare being managed correctly? Is my HMO, PPO being managed correctly? Is workers' comp being done correctly? It's just so much extra stress to worry about, plus be a manager and a therapist at the same time. You got to split yourself in half, and it can weigh on you. So it's not for the faint of heart. It's not for people that can't handle things. You have to multitask. You have to be friends with your staff. You got to be good with your staff. You have to be tough with your staff. It's tough. If you have great, hardworking staff that everyone gets along with, then it's not so bad. But if you have a tough staff that's late, that doesn't care about the numbers, they don't care about productivity, they don't worry about anything, they want to see the bare basic patient load and move on with that. And some therapists do. I've seen a good variety of therapists that are hardworking. I have other ones that are lazy. I have other ones that have been a therapist for a while. They don't want to work as hard as they used to because they've been working for 5, 6, 10 years in it there. It gets pretty old. But incentives like quarterly bonuses, annual bonuses, raises, it makes a big difference. And so you have to be incentive programs for that come along with it. Not every company has that. I was surprised to see when I worked for one company and I work for another company, and they don't have those programs. And it's a little disheartening to know that you're making thousands and thousands of dollars over the budget, and it's just going to corporate somewhere. So it would be nice to be able to put it back into the clinic some form or fashion for new equipment or something too. So hopefully your boss, yourself, or your boss above you can talk about that. But like I said, outpatient is a great facility type of setting for sports, orthopedic conditions, higher level patients where you see them from days after surgery to being able to throw a baseball again or play volleyball or bowling or golf or whatever they're trying to get back to doing, their activities of daily living. For them, it's going to be different from everyone there. So it's tough to do. This is a real talk from a real center manager that had that. I'm not trying to be biased, not trying to tell you what the guys do, but it's just one opinion, one therapist's opinion about outpatient orthopedics. It's a great setting on there too. I do it part-time because it can get burned out in there too. You got to worry about the G codes for Medicare a lot more. The stipulations are a lot harder. Reimbursement from insurances are coming less and less, and it's just tough on there too. So it's harder things to work on there to get paid less and less. It's not worth it in my books. In my eyes, you want to work less and get paid more, and you want to do that. And there are other realms of therapy that you can do that. But I'm an outpatient guy, so I do it part-time to stay in the know with continued education and get your hands in manual therapy in there too. As being a manual therapist, it's nice to be able to still work on your skills and work on that, but also do another job and get paid more money and have more flexibility of that too. So it's kind of the best of both worlds. Just got to do what's the best for you on there too. So like I said, you got some salary information about, being high 50s to high 70s, depending on what part of the country you're in. As a new grad, expect anywhere between the $60,000 range and that too. But there's more than just salary to it. Continued education, tuition reimbursement, travel time, CEUs, just other perks of the job in there too. If you're driving 5 minutes to work versus 45 minutes, it gets old pretty quick if you're doing those, to get driving in the car all the time too. Good hours, good pay, good everything. You want the best of everything too. Remember, your first job might not be your last job. It wasn't for me. My first job, became a staff therapist to a center manager. Now I work for that company in general. So again, like, share, subscribe, all that good stuff. Post comments, questions. We'll answer them for you guys. And as always, thank you.